September is Prostate Cancer Awareness Month, and doctors say 3 out of 5 men will develop prostate cancer as they age, so the goal is always to catch it early.
In tonight's Real Men Wear Gowns, Eyewitness News reporter Jeremy Baker gives us the information men need to avoid this life-threatening disease.
Getting screening is allowing doctors to find cancer earlier and have more options for treatment.
Dr. Michael Liss, a professor of urology at UT Health San Antonio and director for medical research at University Hospital, says most men should start getting screened for prostate cancer at age 50.
If you have a family history or if you're African American, some recommend getting it much younger, maybe around 40.
When most men think of getting a test for prostate cancer, the rectal exam often comes to mind. However, prostate cancer is more commonly diagnosed by a blood test called the PSA.
I usually say it's a little bit variable in men, so it's not the best test per se, but it's the best test we have.
Dr. Ahmed Mansour, an assistant professor of urology at UT Health San Antonio within the University Health System, stresses the need for the test.
It's a non-invasive test, however, the consequences of the test that should be considered.
Some of the signs of prostate cancer include a need to urinate frequently or difficulty urinating, painful or burning urination, yellow discoloration of the skin or eyes, blood in the urine or semen, pressure or pain in the rectum, and pain or stiffness in the lower back, pelvis, hips, or thighs.
Two main treatments of prostate cancer are radiation therapy and surgical removal of the prostate.
But not all prostate cancers need treatment.
If it's low grade and it's focal, that sometimes we can just follow that for long periods of time and men don't need to be treated.
Both doctors agree talking to your physician is of the utmost importance. Jeremy Baker, KENS 5 Eyewitness News.
Yeah, so guys, can't stress that enough. You need to get your PSA checked. Very, very important. It's a simple blood check. For more men's health information, you can call that number 210-358-3045, and you can find the rest of Jeremy's Real Men Wear Gown stories at wearthegown.com.